So I want you to introduce yourself and tell me about your experience over the past year with the healthcare system and the wounds.
Well, my health started deteriorating over a year ago, actually. And I was having more and more trouble getting around with a rollator. My arthritis was getting worse, the pain was getting worse. But I was still, doing for myself and trying to do the best I could, getting around and getting, dressed and washed and all my activities of daily living and getting to what activities I could and getting to doctor's appointments and getting around. But I needed I had tried to do everything for myself, and at that point I had to get the help of an aide to do the laundry because I couldn't even, manage doing the laundry. So after that, let me see them. I'm just trying to figure out the months involved.
It doesn't have to be sequential. It could be just whatever you remember and what sticks out.
I don't know how specific you want to.
No, I don't. It doesn't have to be specific. It's more about your general story is perfect.
Right. So this is October into the holidays, and where I was living, we had another episode of being invaded by bugs, bed bugs. And it turned everything, just upside down. And I had to get, I don't know if anybody's familiar with what you have to do with these bed bugs. This was in the whole institution where I was living. And it eventually got to my place. It just turned my life upside down. And I never really recovered from having to deal with this horrible stuff going on. And I again needed help to do all that and to recover from that episode, and my health really got worse. I don't know if it was just coincidental, but it was just deteriorating. And I'm trying to remember when we started. I had an aide who would come just to the one who would be doing my laundry, someone who would be available if I needed help, just getting dressed or something like that. But I was able to manage still on my own. And then I fell. Well, I had 2 minor slips, at least they remind me about it, but I thought I was fine. I was having a good day. I was enjoy this. I was waiting for the elevator. I was actually early for the church service in the building. I was waiting for the elevator, and the elevators were very bad, and I probably should have filed a claim, but I was just happy that I wasn't hurt. I was trying to get in the elevator, and the doors wouldn't stay open. So I kept pushing the button and trying to get in the door, and the elevator hit my rollator, and that sent me just plopping down on the floor, and I had to get help to get up off the floor. But I was fine. I was up and back within a half hour. That was 10 o'clock in the morning. I got to church by 10:30, so I was just a little late. I'm sorry, 11:30. It was 11 and 11:30. So that was one incident, and that I thought I was fine, but that, I don't know if it just hit my ribs or something, but my whole ribs were not right. I really wasn't feeling well after that. I mean, I was fine, but there was something wrong. I didn't know what was wrong. And then I slid off the bed. Subsequent to that, I don't know how many weeks later, when I was getting out of bed, I just slid. My legs didn't work, and I just slid onto the floor. So I didn't hurt myself at all, but I can't get up off the floor if I'm on the floor. So I needed help getting up off that. And then I guess that was an indication that I was really going downhill. But I didn't pay any attention, of course, because I tried to ignore all this stuff. And then finally, I went back to doing what I was doing, and at that point was getting help and getting dressed, really. Not really, no, I was still on my own with someone available if I needed them. And in the evening, I don't know if I was tired, before I was getting ready to go down for dinner, I was in the bathroom and I bent over to pick up a piece of paper or something. I lost my balance and fell back my full weight against the bars that are in the shower, and I ended up on the floor, and I had to get help to get off the floor. And I was fine. I didn't think there was anything wrong. Didn't think I had anything broken or anything, but they had to call when we fall, you have to call the EMTs. So the EMTs came and they checked me out, and I seemed to be okay. Got me up, and there didn't seem to be anything wrong. But that night I really was not good, and the next day we went to Allen Pavilion we called the EMT, and they took us over there, and they did 3 sets of x-rays, and 3 areas, the shoulder and the side and the pelvic area, and there was no breaks or anything like that. And they sent me home with aspirin, and that was it as far as the fall went. But I'm trying to remember the sequence. When I went to bed, I would lie in the bed because I was aching and what have you from this. I always slept on my side, so I was sleeping on my side for long periods because at this point I needed help getting out of the bed, and the aids that I had would come for 12 hours, and then I would be put to bed, say 8 o'clock at night, or what the sequence was, 8 o'clock at night, and then they would come back in the morning, and I'd be lying in the bed for like 12 hours. So I'm lying in the bed on my side with my left foot hooked like I always did, because I tried to keep my spine straight because of the arthritis pain. So I had my left foot on top of my right. So it was probably pressing down, for that length of period of time without moving. And I got pressure ulcers on my feet. Mm-hmm. And I had to, get wound care for the pressure ulcers. Initially, the aides were just trying to, when they saw that there was something wrong, to patch them up, and they did a fairly good job for a while. But we got a wound nurse and a wonderful wound doctor after, I guess, about 2 weeks. When it really got bad, I didn't keep track of the dates and the times. But they really needed professional help, and that's what I got. Really good nurse and a really good doctor, and they tell me that the wounds healed very much, much better than expected, considering my age and my circumstance. So I'm just very happy that they're healing up, that they're almost healed. And I've been trying to, with the healing process, I've been trying to get strengthened because with the wounds such as they were, I had to get into a wheelchair, which I'd never done in my life, and which I really want to get out of. And I've been getting all kinds of professional help to try and help me to do that therapy, and physical therapy, occupational therapy, exercise, just a lot of help.
What do you think was a recipe for success, turning everything around for you?
Realizing that I couldn't do it myself.
Mm-hmm.
That, it was just before it was just me and the
Right.
Lord,
Right.
talking to each other.
Right.
And finally, this woke me up. I said, "This is why did this happen?
Right.
Why I always bent over and picked something up. Why this time did I fall back like that with my full weight and really bang myself up?" So I said, I think that was a sign of some sort that I have to give up a little bit of my independence and, accept the fact that I need help.
Right. That's a hard thing to do.
Yes.
Who are the key people or key things that provided the help that you needed?
Oh, my children.
Okay, great.
And even my grandson. They're wonderful. They took over, sort of. Right. And said, you're not doing the right thing. You have to do this, that, and the other thing, and made sure that I did what I was supposed to do, which I hopefully would have done on my own, but they made sure and they made it financially, accessible. I could not have paid for the care that I had. So, they're a blessing.
What would you have done differently if you could have?
Oh, I'd have to think about that.
You may not have an answer. That's okay too.
And differently. Well, I would have gotten help earlier.
Okay.
Earlier. Not been so stubborn. Yeah.
We're all stubborn. If I have a patient or somebody else that needs help, what would you recommend? If you wanted to tell, like, say, if you could tell someone like you, what kind of advice would you give them? If they had a wound, or they needed help, or they're at home and having difficulty, what would you advise them?
Well, seek care.
Okay.
I mean, don't just struggle along, saying, well, it's all right, it's good enough. If it's not working, you've got to look elsewhere and just up the ante a little bit and just try to find a way to get the proper care. Research it.
What else would you like to say, or what other things would you like to say, or that can help people or help other patients?
Oh, well, just to try to keep a positive attitude. Mm-hmm. And the way to do that I find is through faith and prayer. And know that this isn't the end of the world. This is there's much more ahead if you can work it out, and if you keep struggling and keep believing that it's going to get better. Mm-hmm. And one of the ways to do that is to try to make it better, and then also to believe that it's going to get better, and whatever is supposed to happen will happen, and you have to work on it. I mean, you can't just have the Lord do all the work. You have to do the work too. And it's all just struggle. It's not easy. But I have to be more grateful for the help that I get, because I've not expressed the gratitude that much, because it has been so difficult. But I just don't know when this exactly is going to be over, because I'm going to need some kind of care and help for the rest of my life. However long that is, I have no idea.
I mean, you're much better today than when I first saw you several months ago, and the fact that you're asking for help is a big thing.
Oh yes, yeah, it was very, because I was was in such, I didn't know what was happening, how well I could get, because besides the wounds, I was not moving.
Yeah.
And as the wounds got better, I was able to progress a little bit and make some more positive efforts towards getting out of the wheelchair. That's all I can say. That it seems like a long time, but I guess in relatively speaking, it's in the world of wound healing, it's not such a long time, and you just have to be patient and try to do what the doctor says.
Well, also you put a lot of work in from multiple different angles, and I think that changed everything.
I suffered a lot just by trying to do the best thing I could for the feet, and I just have been uncomfortable by trying to keep them elevated, which was the main thing, and just having wonderful care, wonderful nurses and doctors and people who care, and following orders and trying to listen to other people and do what you're supposed to do. And I don't know what to say, but I know great.
Yep.
No solution to anything. Just hang in there and believe that you're going to get better, and do what you're supposed to do and follow up. And be grateful, and give thanks to the Lord. You're not just. I try not just to ask for anything. I just try to have a conversation and say, what's going on? What should I do? And you have to listen, and and not just shut down. I just don't know how to put it, but I'm just very happy that the doctor has time to do this, and hopefully it's helpful for other people to know that you can help yourself, by doing the right thing and believing that you can help yourself, and believing in the Lord, and believing in other people, and believing, be very thankful for any help you get. If you have family, that's a blessing, and if you don't, there is help. There are places and people who can help you also. If you don't have family, there are resources, and I didn't have to, do that myself. I had my family to help me find those resources. So I don't know what else I can say.
That's great. Thank you for sharing that.